Hello everyone, Dr. Smith, physical therapist here, and today I'm going to give you 7 to 10 tips on going into home health, whether you're a seasoned clinician or whether you're a new grad going into home health. These tips are going to really help you avoid the shadier agencies and hopefully put you in a better position with a higher salary. So my first rule is that if the agency that you're going to sign with doesn't have nurses, don't do it. The reason I recommend having nursing is it's much easier for collaboration of care, the patient gets better care, and usually if it's therapy only, you're gonna get paid less, and again, it's gonna actually harm the patient not having the continuation of care from nursing to therapy, and it also helps with med management, wound care. Even though that's in our scope, it just sometimes helps to have the nurses there, and I would say do not sign with any agency that does not have nurses because they probably are underfunded or do not care about the collaborative care that's going to benefit the patient the most. So that's rule number 1. If there's no nurses, make sure that you just don't go to the agency unless you absolutely have to. Number 2 is if you are using multiple EMRs, say you're not using just Kinzer or Devereaux or Home Care, Home Base, but you're using all of them, this is not a real company. Well, it's a real company, but it's not a real home care company. It is a staffing agency posing as a company and probably taking your percentage of every patient you see and paying you less while they just make profits off of you. Again, this is another company I say run from. You know, if you need the money, you need to do it, okay? But try not to get in these positions in the first place. So no nurses, multiple EMRs. Number 3 is how are they getting referrals and who are the usual patient? If the referrals are coming from a shady source or a shady healthcare center, or if you're noticing or you ask, most of the patients are dementia patients in memory care, are they really providing skilled services or are they committing Medicare fraud? Because yes, you do need to provide services to patients in the dementia unit, but once you have tried and if nothing has happened, there's max potential, there's no reason to keep that patient on service, which brings me to my next point, which is how long do they usually keep people on services? If a company tells you that, oh, you're gonna keep them on for the whole cert period, which is currently 60 days, unless they're very, very sick and you've done the eval, you know, it's your clinical judgment, but if a company tells you they wanna keep them on the whole 60 days, especially a dementia patient, that company is committing fraud and you should not work for them. Okay, so now that we kind of cleared out the red flags, when you're looking for a job, you wanna make sure you have a defined territory, and that's gonna come into another factor in a second. Your mileage reimbursement. I've seen some companies be shitty and say, oh, we'll give you $5 per house, but you actually lose money on. I think right now the national average is around, or the max is like 55 cents a mile. I've seen those as low as 30. You know, try to go with the highest you can get, especially right now. So make sure you have mileage reimbursement, make sure you have a defined territory. If you go over, say 30 miles, make sure that counts as an extra point, which I will go into in a second. Just to make sure you're not driving and not getting paid for excessive drive time. You want to make sure that excessive drive time is compensated. And then another point here is if documentation is expected at the time of service, are they going to give you a tablet or an iPad with cellular service so you can do it at the time of service? Because if they don't give you that and they say they're not paying for documentation, you are basically working for free, and I know that you did not become a licensed healthcare professional to work for free. And then going back into the point now is, are you gonna go on salary or PRN? So PRN and home health is you're gonna be basically an independent contractor, and you're gonna see a visit's probably 1 point, an eval is probably 1.5 points, a starter care oasis is probably 2 points. Same thing with salary. The difference here is that PRN is that you can refuse visits. Like you can go to the house and you can be covered with bugs and roaches and you can be like, fuck this, I'm out. So that's the benefit of PRN is you can refuse. Salary you usually can't refuse, but the benefits of salary is usually, I would say, go for a full-time caseload of 25 to 30 points per week, which is what I just broke down there, which is the visits, PT visit is 1 point, the eval is 1.5, the starter care is 2, sometimes discharges are 1.25, but it really depends on what you're doing in your company. But I say the full-time caseload is 25 to 30 points a week. But the benefit of salary is if you're low, you don't get punished. if you work for a good company, hopefully, and you still get that salary. And then also I would have a conversation if, like, say you're the only PT and you're going over that 30, you should be compensated at the PRN rate once you go over those 30 points. If the company is ethical, they will do it for you. If they're not gonna do it, I recommend you find a company that does. Now going into the PRN rate, this, what you will usually see, because you're not on salary, usually I would say it's gonna vary a lot depending on where you're on location, but I would not settle for less than $70 to $80 per visit, $100 or $90 to $100 plus eval, and $150 to $200 plus in the Oasis Start of Care. If you look at the insurance brackets when you do an Oasis Start of Care and like what they compensate, it's $160 per visit. You know, obviously that's what the insurance is going to charge them if they're paying out of pocket, but that's what I would go as like the lowest. Those numbers I gave you are the lowest. Hopefully you get much higher, but that 70 for the visit at the low end, the 90, actually I'm not gonna say 90, say 100 for the eval, and then I don't remember what I said, but 180 to 200. I wouldn't go under 180 for a Starter Care Oasis, just because it takes time. You have to do the med list and all this other stuff. I hope this video made sense and kind of gave you an introduction to home health. Again, if you need to have more questions about it, reach out to me. I'm also putting together a guide on this this video will be linked in. But this is kind of like the basis, because I've seen people get fucked over. I almost got fucked over myself, and I just want people to not work for shitty companies. My main goal is to have all of these shitty companies go out of business, because when people stop doing shitty things and shitty companies go out of business, what happens? The physical therapists are happier, people enjoy their work more, and overall the patients get better. So that's it for kind of this home health guide for the PTs going into the field. Again, if you have any questions, reach out to me, and thank you.